And we can go ahead and advance the slide, please. Perfect. So today we are going to cover what are some normal changes that we can expect as we age. We'll also go into what are some common eye conditions and diseases in older adults, as well as some warning signs or red flags. So other than seeing your optometrist for an annual exam, when are those times where you should come in sooner? We're also going to go through different prevention strategies to preserve eye health and vision the best we can. And another topic that's near and dear to us is called low vision. So we're going to go over what that is and what kind of options are out there if you do have low vision or a visual impairment. Perfect. So why does our eye health matter more, especially after age 60? So as we'll see later in the presentation, age is a risk factor for a lot of different eye diseases. Also, we're going to learn how our general health really can impact our eye health. So things like high blood pressure, high cholesterol, diabetes. As there's changes in these kind of factors in our general health as we age, these can actually impact our eyes as well. And we're going to really kind of hammer home the importance of early detection in eye disease. So getting those annual exams and detecting any kind of disease process early lets us treat it and preserve the vision the best we can down the road. We're going to also discuss different resources to, if someone has vision loss, how we're able to help maintain your independence the best that we can. All right, so we are going to jump in talking about kind of what's normal. So understanding some normal changes in our vision as we age. So the first one being what's called presbyopia. And what this is we have a lens inside our eye that helps us focus up close. And over time, it just gets less and less flexible. So we lose that ability to focus and keep things clear up close. So this is why around age 40 or so, we start needing reading glasses in most cases. And again, this process happens to everybody. So this is a normal change. Again, it's why we start needing reading glasses to help our eyes focus up close at about age 40. And it's common for us to have to increase that reading prescription a little bit for you until about age 60 or so. So it doesn't necessarily keep getting worse and worse over time.
I like to just presbyopia is Latin for old eyes. And this is where we are, we like to say it's our arms are shrinking. You can see everything, and light becomes our best friend. So if you try to read in the dark like we did as kids, not going to happen. So, but there are different ways that we can help you. This is just a very normal aging process that we all have to deal with when we start to mature.
Sure. So we are also going to talk about some floaters. So these are normal, I want to say most of the time. So little asterisks there, we'll come back to floaters, but most of the time these are normal changes over time. And what they look like are these little gray spots or strings that float around and move within our vision. Oftentimes they're most noticeable if we look out into the bright blue sky, if we look at a bright white wall. We kind of notice in that photo some of those dark spots that move around with our vision. And what happens is we have some changes to the gel part inside our eye, which is called the vitreous. And if you imagine the diagram on the right, we're kind of splitting the eye in half. You can see on the left, there's this nice clear gel that forms the inside of the eye. On the right, there's those dark spots. So the vitreous gets these almost clumps that cast shadows, which are these dark spots that move around in our vision. So this happens naturally over time. So most of the time, floaters are a normal process that occurs. Go ahead, Dr.
One comment on this, very, very normal. I was hit by a car when I was 4, so I have hundreds of floaters. I look at it as God's gift to me for entertainment. If I ever get bored, I can just watch my floaters. You'll never be able to catch them. And it just look at it because you'll never, they can kind of get stuck, but then you blink and if they ever get in the way, you kind of shake your head and it moves it over to the side. But it's just your built-in entertainment, which we need as we get older.
Yeah, often it'll look like a little fly that comes up over there.
Yes.
Okay, what also happens, and Dr. White mentioned this already, is over time, our pupils, which is the black circle in the center of the eyes, naturally get smaller. And that just means we need more and more light over time. So it's not letting as much light in. So light is gonna become your friend, especially for reading and any fine detail task. There are also changes in our natural lens inside the eye, which we'll get into as well, but it makes us a little bit more sensitive to glare. And the headlights, I promise for everybody, are really bad, but especially once we start having those normal lens changes, the headlights at night can be really difficult to drive with. And lastly, we'll notice some more kind of slower adaptation. So if we're going from a bright sunny day into a dark restaurant, it can take our eyes a little bit more time to adjust in those cases too. Okay, I wanted to bring up this one because we live in beautiful sunny California and almost all of us have these changes just due to sun exposure over time. So if you see in this photo or if you look in the mirror, some of us have a little elevated yellowish white part or a yellowish aspect on the white part of the eye, and it's called a pinguecula. And what this is it's just due to sun exposure over time. Most of the time, it doesn't cause big problems. It can become inflamed, and we can use some lubricating drops or prescription eye drops if we need to. But a lot of people have these, myself included. And the best thing to do to kind of prevent changes in those is just wearing some sunglasses or a hat, protecting the eyes from UV over time.
And sometimes you'll see they actually can start to grow. Those are called pterygiums.
Mhm.
And if it starts to affect your vision, they can be taken off. But most of the time, if you keep your eye lubricated and wear sunglasses, it keeps it from getting worse. Very, very normal. When we see this, we go, "Oh yeah, you're Sunbelt states. You're not, in the Midwest."
Yeah, thanks, Dr. White. So now those are some normal changes. We're also going to transfer into what are some common like eye conditions or eye diseases in older adults as well. The first one, and this one's hard, it's a disease, but it will happen to everyone if we live long enough. So this one is also one that we can expect, and it's called cataracts. So again, we talked about this lens that sits behind the colored part in our eye. And what a cataract is it's clouding of that lens over time. So it becomes kind of cloudier or blurrier. And that means light can't pass through it, which causes our vision to be blurry, kind of dim. It can also cause a lot of light scatter or glare. And again, this is a very treatable cause of reduced vision, which is great. And again, it's going to happen to all of us if we have the opportunity to live long enough. And I do want to make a note, and we'll talk about this in a moment, but cataract surgery is one of the safest surgeries, and it's very, very commonly done. So this is a very treatable form of
Yes.
reduced vision.
And what I always like to tell people is about the age your parents or your grandparents have the surgery is about the age that you can start thinking about it. But absolutely guaranteed 100% of the time, by 110 years old, you will need cataract surgery.
So some of the symptoms we kind of touched on, but kind of a blurry, cloudy, or dim vision. And what's important to note is that if we update your glasses prescription, it doesn't help enough. So no matter if we give you the best glasses prescription, if we have a cloudy lens inside your eye, it's almost like trying to look through a foggy window. So even with the best glasses, we're not able to help improve your vision as much that way. Sometimes colors can seem a little faded or yellowed. And again, we do get some increased glare.
One question on that, like Dr. McKenna just said, is a lot of times we'll give you the best possible, but you hear the term, is it ripe enough for surgery? A lot of the insurance companies have what is called the 20/40 rule, that if you can be corrected to 20/40 or better, you cannot have insurance cover the cataract surgery. And that is really upsetting to a lot of people, but we give you the best possible vision. And when it finally gets to the point it's not good enough, that's when we have to start thinking about cataract surgery.
And then again, what cataract surgery does is it replaces that cloudy lens. It takes that lens out and puts in an artificial clear lens. Again, it has a really high success rate. The procedure itself is very quick, probably 10, 15 minutes. What the recovery looks like is you do have to avoid certain activities for a few weeks. Most people are feeling quite a bit better within the first few days, but for a couple weeks, we don't typically want you doing contact sports, swimming, things like that. And you'll be on kind of a drop routine as the eye heals for about 4 weeks as well. And again, you may go home with this type of kind of patch like you can see in this person here for the first couple days as well. Okay, so glaucoma is another common eye disease, especially in older adults. And what glaucoma is, it's damage to the optic nerve over time. So the optic nerve is a structure all the way in the back of our eyes. It connects our eyes to our brains. And usually, but not all the time, if we get damage from the optic nerve, it can be from elevated eye pressure. And what's difficult about glaucoma is it's usually painless, which is good, but it means we don't always know that this process could be occurring. So no pain, glaucoma usually affects the peripheral vision, but can affect centrally as well. And when it's in its early stages, it's really difficult to notice some of those early changes. So with that diagram on the right, you'll see our normal vision, we have our full peripheral vision. In early glaucoma, we can see those changes, but they could be difficult to pick up on. And then if the disease is able to progress, we can get this peripheral vision loss that can be more significant.
The biggest thing looking at this, if I asked you, is your peripheral vision any different than it was yesterday? We don't know because this is such a slow changing. Also, if I asked you if your pressures felt different than yesterday, we don't know. This is why it's imperative to have your eyes checked, annually, just to make sure that it's not starting to creep up.
So some different risk factors for glaucoma. One is age. Another one is family history. So if siblings, parents have glaucoma, that does put you at a little bit higher risk. Another one is a higher eye pressure. Again, this, unless it's very, very high, typically you can't feel or don't know if your eye pressure is elevated. So exactly what Dr. White said, regular eye exams are really, really important for that reason. Previous trauma to the eyes can put you at additional risk. Same if you're highly nearsighted, so if you need glasses to see far away. Additionally, people of African, Asian, or Hispanic descent are more prone to certain types of glaucoma. There are other risk factors kind of with the structures of our eye. So if the cornea, the front surface is very thin, which that's something we can measure if we do suspect glaucoma in a patient. If we see kind of changes in that optic nerve in the back of the eye, or if you have some other conditions, either diabetes can put you at slightly increased risk of glaucoma, even fluctuations in blood pressure. So not just high blood pressure, but also low blood pressure. And important to note, we get a lot of questions. Does my high blood pressure mean I'm going to have a high eye pressure? Not necessarily. Not necessarily, but it is important that we do check your eye pressure at an annual exam. So with glaucoma, our goal is often we will see that you have some risk factors, and we're going to do a lot more testing for you, and we'll start seeing you more frequently because we need to monitor, is there a change in the structures in the eye? And is that starting to affect the vision? Are we seeing changes in your peripheral vision? If that's the case and we do diagnose glaucoma, our goal in treatment is to prevent any further vision loss. So it's important to note that any vision that has been previously lost can't be restored in this case. So another reason that really important that we're kind of being monitored closely. What treatment can look like is daily use of eye drops to lower the eye pressure. There's also a type of laser procedure that lowers the eye pressure that can reduce the need for drops in a lot of cases. In very advanced cases, a surgical procedure would be needed as well. But again, early detection, you're going to hear this time and time again, that's going to be key.
So I like to kind of explain glaucoma is we all have drains in the eye, and in front of the drain is a grate. So a lot of times what we do, okay, is this grate as we get older, leaves and dirt and debris get in front of it. So the first idea is you use drops to open up that grate so more fluid can get out of the eye. When that doesn't happen, a lot of times they can laser and blow a hole in the grate to let more fluid out. And then the last, they can put another drain in to help get the pressure because for whatever reason, the pressure starts building up in the eye, and that's what pushes on the optic nerve that can cause the periphery. The smaller blood vessels are in the periphery, and it slowly goes in. And that's where it becomes. I was on the board of the Center to Prevent Blindness, and we had Kirby Pluckett. A lot of you might remember him, a baseball player at White Sox. Well, he, had obviously money to be able to afford an eye exam, but he never had one because he had perfect eyes. Well, he realized one day when somebody walked up to the side, he had no peripheral vision. He went in and he went blind very quickly. It takes a lot of time, but as it gets more advanced, it builds up speed. And that, again, early detection is key. Not to scare you, but once a year just to have your pressure checked to make sure everything's okay. Glaucoma is a scary disease if you let it go, but there's a lot of medications, there's a lot of newer procedures to really help to prevent this now.
Perfect. Thanks, Dr. White. Another common one is called age-related macular degeneration, or you might hear AMD. And what this is the macula is the central portion of the retina. So this film all the way in the back of the eye again. And the macula is responsible for this fine detail, central vision. So any detailed task that we're doing, reading, recognizing faces, driving, that's going to be most affected in macular degeneration or changes in the macula itself. There are two different types that you may have heard of macular degeneration. One is called dry macular degeneration. This is when there's kind of some buildup of debris in the macula. It can cause gradual thinning of this tissue over time. This type typically progresses more slowly over the years. There's another type called wet macular degeneration. What this means is there are these abnormal blood vessels that shouldn't be in the macula, and they're leaking fluid and causing this swelling. And this can cause, more severe vision loss, and it can come on more quickly. So this is certainly more of a severe form. However, dry macular degeneration can also be severe, but again, it's typically later in the disease process. And again, you can see in this photo on the right, it's the central vision that's typically affected. So we'll show you another photo in a moment here, but there's typically some blurriness, kind of a darker spot or distortion right in the center, while your peripheral vision is typically maintained.
And this is actually one of the more sad and scary disease processes because we've always been taught if you want to look at something, you look at it. But a person that has macular degeneration, it's like putting your hand in front of your face. You have to learn to look around the vision to fill in the pieces of the puzzle that are being taken out. And this is again, once this happens, there's a lot. Dr. McKenna is going to go over a lot of different things that can help. But this is one of the more scary. You never literally go blind, but it's just not a real fun thing.
Yeah, thanks, Dr. White. That's an important thing to note is, people will be afraid that their vision will go completely black or dark, which in macular degeneration typically isn't the case, but you do, lose this area of central vision that we've depended on to do all of your daily tasks, but you still have this peripheral vision that does really help with a lot of mobility. So some things that you'll notice in macular degeneration, this is kind of blurry or distorted central vision. Some people will notice that if they look at a straight line, like a door frame or edge of a piece of paper, the lines will almost appear a little distorted or wavy. We can get kind of a dark or blank spot in the center of our vision. And again, this really affects, fine detail. So that's where we have difficulty doing any tasks with those really small fine details.
And
There
one
are,
thing,
yeah, go ahead.
I'm sorry to interrupt, but one thing, this is what is called an Amsler grid. And you can download this anywhere online now and all that. But it's something, if you're worried or you have family history, even getting one of these and putting it on the refrigerator, and every once in a while, just what you do is you look at the center dot cover one eye at a time. And if you look at the center dot and all of a sudden you're seeing a little waviness or you can't see the center dot, that's a sign, go in and get it checked.
Yeah, perfect. And try to do it one eye at a time. So cover one, look right at that little dot in the center, and then try the other one too.
And the reason you do it one eye at a time is God gave us two eyes to, to cover the blind spot. So it covers, it hides the problems a lot of times.
Right, exactly. So sometimes there'll be changes in one eye, but if you have a strong eye that your brain's using, it can fill in those areas in the other eye. So we say sometimes do it 2 or 3 times a week, just a quick check. If it's on your refrigerator, it makes it easy. All right. So different risk factors. Again, it's called age-related macular degeneration. So older age, the more birthdays we have, the higher risk we are at for AMD. Also, smoking is a big one, and this one's important because it's one of the main kind of risk factors that we can modify. So smoking certainly, makes you more prone to macular degeneration. So whether it's reducing smoking, quitting, not starting, that's all going to be helpful to reduce your risk. And family history again, so if you have siblings, parents that have macular degeneration, it does put you at increased risk. It doesn't mean that you're for sure going to get it or go down the same course as a parent, but it is a risk factor that's there. And lastly, UV exposure, so sun exposure over time again. For treatments for macular degeneration, so typically the treatments are when it's at more severe stages. So in early macular degeneration, when it's in that dry form, what we're doing is we're monitoring it and we're trying to preserve the health of the macula the best we can. So this is one, reducing risk factors. So again, smoking is a big one, sun protection, as well as supplementation. So AREDS2, that's a type of combination of vitamins and also has two key pigments, lutein and zeaxanthin, that help maintain the tissue in the macula. So if we see any changes, that's something that we recommend taking and supplementing with. You'll also find these pigments, lutein and zeaxanthin, in green leafy vegetables. So your kale, your Swiss chard, but if you're not eating enough of that, sometimes we need to supplement that because I know that's not the most exciting to add to your diet.
Yeah, right.
The There are treatments that are more at the severe stages. So whether it's wet macular degeneration or a severe dry form, and these are different injected medications. So it is an injection in the eye. It sounds a little bit scarier than it is. I promise.
Interesting, because you think of they literally stick a needle in your eye, in the back of the eye. But I have never had it done personally, but I've talked to so many people, and it's not as bad as you think of sticking a needle in your eye. But, it's something, if you are at that point, you need to think about it. Don't be scared because there's things they can do to make it that it really isn't as unpleasant as you think it's going to be.
Okay, next one is diabetic retinopathy. So this is when if we have diabetes and a higher blood sugar, what that can do is damage some blood vessels in the retina, which is in the back of the eye. It can cause them to leak, which can cause them to cause some swelling or grow abnormally. And again, this is one where some of the early stages don't have symptoms. So it's hard to tell that these kind of things may be going on, these complications. So again, that's why it's really important that we get a retinal exam, especially if you're diabetic each year. Some of the advanced stages can cause, distortion, some blurry vision, even some more severe forms of vision loss, depending on the complications in the retina. And it's important to note that your risk, oh yeah, go ahead, Dr. White.
Oh, and one thing on that, this is why if you do have diabetes, your endocrinologist, your internal medicine, your general always asks you to have your eyes checked because when we look inside the eye, we can see if there's any beginning of any leakage and prevent and get help before you get the distortion, the blurred vision, this vision loss. So again, prevention is really worth it, and that's why they keep bugging you to have your eyes checked.
Yeah, they're typically good at making sure that that's done each year too, or at least reminding you, which is great. And what's important to note is we have an, interesting opportunity where we can see through our photos and our exams, like we can see those blood vessels directly. And, those changes are not just happening in the eye, but can be happening in the rest of the body too. So it gives us really good insight to, does the blood sugar need to be better controlled? And the risk for retinopathy or changes in the retina increases the length of time with diabetes. So it's especially important if, someone has been diabetic for 10, 20 years, that they're getting this your eye exams and this treatment if necessary, and with higher blood sugar levels, of course. Treatment, again, is mainly going to be managing the diabetes itself. So lowering blood sugar, even blood pressure, cholesterol, that'll reduce your risk for diabetic retinopathy. In more advanced cases, again, there's laser treatments or even injections. And again, same thing as many of these other diseases, but prevention is key for this one as well. Okay, so dry eye is very, very common. It affects people of all ages, but you know, with more time in older adults, we can see this even more frequently. And what dry eye is, it's a chronic disease for one, so it can be tricky to treat. And it's when our eyes either one, don't produce enough tears anymore to keep our eyes moisturized and lubricated, or two, this one's important, the tears might be there, but they're not good quality. So this is why it sounds counterintuitive, but watery eyes or tearing can actually be from dryness or our tears not having all the components that they need to. What can happen is an important part in our tears is this oil layer, which we'll talk about. And if that oil layer isn't sufficient, our tears don't stay on our eyes very well. So they can just run and run and run, and our body produces tears and it's causing watery eyes, but it's not necessarily getting the lubrication that it needs. You can also notice, we can notice irritation, burning, stinging, kind of a gritty or sandy feeling in the eyes. The eyes can be red, and also it can cause some fluctuating vision too. There are many, many treatment options for dry eye. Some are just things that you can do at home. So one, staying hydrated is very important. Supplementing your diet with omega-3s. So that's like a fatty acid, and that makes up some of that kind of oil layer that coats the front surface of our eye, which is important to keep our tears there and lubricating our eye. Also, just some environmental adjustments. So that might be wearing some better wrap sunglasses when you're cycling outside. It might be making sure we don't have a fan blowing directly at us at night. So those are some of the most basic changes just in lifestyle that we can make. There are also hot compresses. So this person on the right is using a nice eye mask. What the heat does is it helps the oil glands that are in our eyelids. So these oil glands secrete this oil that we've been talking about onto the front surface of the eye. And those are really commonly can get kind of clogged. You can imagine it like a butter. And what the heat does is it kind of melts that butter substance into this oil so it can lubricate the front surface of the eye. And what's important with those is ideally using a heat mask of some type of heating pad or an eye mask that you can put in the microwave, just because we need about 10 minutes of heat on the eyes before we really see better effects. So a warm washcloth just doesn't do quite enough as much as we would like.
A couple things about that. Hydration. You have to drink a lot of water. Believe it or not, as we get older, our system dries out more, and we have to keep the dipstick full, as I like to say. So you really need to drink, drink, and drink more water. Also, a couple things, drops. I have a lot of people say, well, you say put the drops in 2 or 3 times a day. If I do it four, is it going to make it worse? No, you can keep your eye moist. If your eye needs, listen to your eyes. If it needs more drops, give it more drops. Also, one of the things, if we look around your eyelid, right at the lid margin, and it really is red, and sometimes you can get little styes or little bumps, a lot of times we have what are called meibomian glands or glands along the eyelids that get plugged. If they're plugged, they can't mix it with the tears to keep the eye moist. So a lot of times getting a lid scrub, even baby shampoo, and lightly scrubbing your eyelid, both eyes for 30 seconds, put a warm compress, or wash off your face, put a warm compress on, and just kind of push on the glands. What you're doing is you're trying to get the glands to excrete. dry eyes is very, very common, especially in San Diego. So just there are things that can be done over the counter and different drops. Even, the Sustain is really good. And one that I always like is a gel drop, either Sustain, Refresh, Blink, but it's a gel. It's a little thicker than artificial tears and it stays on the eye a little longer. You put a drop in before you go to bed and a drop in when you get up in the morning. A lot of times so always think if you don't the bottom line, you don't have to suffer if you have dry eyes. There's a lot of things that can help to make it better. Just and if you have questions, go see your eye care professional to find out what it is.
Yeah, exactly. There's lubricating eye drops and gels and even an ointment at night, which can coat the eyes all night long. There are prescription eye drops that have this oil component or that reduce inflammation or that actually help promote tearing. So there are lots of options out there, even in office therapies and treatments now as well. Okay, so we've talked a lot about different eye diseases. So now let's go into how can we kind of protect our eyes and preserve our vision the best we can. Okay, so different prevention strategies. You've heard this one a number of times, but annual eye exams. Again, early detection of any eye disease process can really help prevent vision loss down the road. Secondly, protecting your eyes from UV light or sun exposure. So wearing that hat or sunglasses when you're outdoors. Again, that sunlight can contribute to changes on the front surface of the eye, but also cataracts and macular degeneration as well.
Hmm.
Quitting smoking or never starting, that's going to reduce your risk for macular degeneration. We touched on this a little bit, but there's things that you can eat that help the eyes. So those leafy greens have these two pigments, lutein and zeaxanthin, that's going to help the health of the macula. Those are in, again, kale, Swiss chard, spinach. Omega-3 fatty acids is another one. So there are supplements that you can get for specifically for dry eye that have these particular omega-3s in them, but you can also get them in a lot of fish and nuts. We also talked about how we want to just try to control any systemic conditions. So making sure we're managing any diabetes, high blood pressure, high cholesterol. So these can directly damage some of the blood vessels in our eye and cause some retinal diseases. So making sure we're monitoring as we should with our primary care doctor is really important. And lastly, exercise is great. Keeping the body healthy is going to help maintain healthy eyes as well. A few other notes I just wanted to point out. There's certain things that we can just do at home to try to keep our eyes comfortable as well. One of them is going to be good lighting. So using bright, even lighting, especially for reading. So this type of kind of gooseneck lamp is really helpful. Something that sits between our eyes and the paper is going to be most beneficial rather than something that's causing glare or reflections that's harder to see.
Yes, remember, as we get older, we need more light. Light is our best friend. And that's why if you're struggling reading inside, if you go out into a bright sunny day, you're like, wow, I can read great. That's because light is our best friend. And so you make sure as we get older, I know with gas and electric bills and all that, but light, you need bright lights. And a lot of times, just if you're going to sit down and read, make sure you have good lighting.
Yes, exactly. Also protective eyewear. So wearing safety glasses for things like yard work, woodworking, even working with chemicals. Sometimes I'll think I should put my glasses on before I go clean the bathroom just in case there's a splash of something, just because chemicals can have really harsh effects on the eyes too.
If you're going to work outside, protect your eyes. In fact, I was out last weekend and our neighbor was weed whacking and he didn't have any safety glasses on. So I walked over there and I said, "What are you doing?" He goes, "Oh, yeah, I forgot I have an eye doctor across the street. Okay, I'll go get my safety eyewear." But you don't want to take a chance because you think you can blink fast enough for a piece of a rock flying in your eye. And the cornea, the front of the eye is the most sensitive part of the human body. That's where you get a piece of dust in it and it hurts. But we can wear clothes on our skin because we don't have the nerve endings. So that's why protective eyewear is so imperative.
Yes, thanks, Dr. White. Also, something we don't always think about, but different medications, sometimes we get a collection of medications the older we get. And what can happen is some of these medications can affect our eyes. So it can either affect the focusing system, it can cause some dryness, it can affect your eye pressure. So kind of monitoring those with your doctor or with your optometrist are also important to keep in mind. And lastly, a lot of these eye conditions, glaucoma especially, can increase the risk of falls if you have some of this vision loss, especially peripheral. So making sure at home, once again, having good lighting around the house, having a good up-to-date glasses prescription, and sometimes even using, and we'll talk about contrast in a moment, but some bright colored tape on steps, if that's helpful, that's an excellent thing to do just to prevent falls in and around the house as well. Okay, so we talked about that we need to keep up with our annual exams with an eye doctor. When are some of those times where we need to come in sooner, come in right away? So on the left here in red, some of these instances are, where we would want you to come in immediately, either calling your eye doctor if the eye doctor is not available, even calling 911 in that circumstance. So this would be, sudden loss of vision in one or both eyes. If we suddenly are not able to see and everything is dark, that can be, a sign that we've lost blood flow to the eyes. And that can mean we're losing blood flow to the brain. So in that sort of case, we worry about stroke risk. So that's an instance where we would want you to seek care right away. Also, sudden, severe eye pain and redness that can be associated with even headache around the eye, nausea and vomiting. That can mean you've had an eye pressure spike. So getting to see someone as soon as you can. Also, any injury, whether it's from trauma or chemical exposure, getting treatment as quick as you can is going to reduce longer term kind of impacts on your vision. Similarly, double vision, that won't go away. If you immediately have double vision or you notice when you look in the mirror, your eyes don't move in all the directions that they should, that's again risk that there could be something going on in the brain or risk of a stroke. So that's when we'd want you to get care immediately as well. Also seeing almost a curtain or shadow coming into your vision, we'd want you to get to an optometrist or ophthalmologist right away, just because that can mean something's going on with the retina in the back of the eye too.
The biggest thing that we're trying to say is listen to your body, listen to your eyes. We have to be an advocate for our own body. And so, God gave you one body, so take care of it. And this is where, listen, thinking of these different symptoms, signs and symptoms, listen to your body. If it's not normal, get it checked. There's professionals out there that can rule out bad stuff.
Yes, certainly. Some other instances are if, within the same day or so, not as, emergent, but if you get a sudden increase in floaters, we talked about how a lot of times those floaters are completely normal. But if all of a sudden there's lots and lots of dark spots floating around, or you get flashes of light in your vision that aren't really there, that would be a time that we'd want you to call your eye care provider and try to get in that day. Also, if your vision is almost distorted, we kind of talked about those lines looking wavy. That's another time we would want you to come in. Or if you have an eye that's red, painful, has discharge, those can be some signs of infections. Or again, if there's any significant sudden change in your vision. So again, if something seems out of the ordinary, it's best to get that checked out so we can help the best we can. Okay, so next I want to talk a little bit about what low vision is, and know that there are so many options out there if you do have low vision or any type of visual impairment. So what is low vision? So what this means is it means vision that cannot be corrected with glasses or contact lenses or surgery. So it's some type of visual impairment that we're not able to kind of correct. And that can be from any number of disease processes. It can be, some sort of genetic condition that a person was born with. So there's kind of a wide spectrum as far as vision loss and who has low vision. A lot of times low vision isn't blindness. So most people that have certain visual conditions impacting their sight still have some usable vision. So what low vision rehabilitation is a certain specialty with the goal being we're trying to optimize any usable vision or sight that someone has to try to enable just more independence, improve quality of life for that person the best we can with the vision that they have. And it's just important to know anyone, whether you've experienced it or someone else, friend or family member has, anyone with vision loss is going through a grieving process. We're losing, one of our senses that we depend on for everyday tasks. So it's a difficult process to go through. And it's also a process of relearning. So we're having to kind of relearn, and our brain is amazing at doing a lot of this, but relearn how to do some of these daily tasks. And the biggest outcome in what we'll talk about is we want you to know that there are lots of resources available. So we'll get into that next. So some of these are optical aids. So this could be a stronger pair of reading glasses. This could be a handheld magnifier kind of on the top. There are different options for telescopes, so trying to give you magnification for distance viewing. The two people on the bottom are using different types of telescopes, and sometimes these are used to see a crosswalk sign to know when it's safe to cross. Sometimes they're used in the theater or checking the score of the game. You'll notice the woman on the bottom left, she has a wearable type telescope device. Some people are using these even for driving. So there are lots of things that we can do that are out there to help optimize the vision that you have. We also important to note in the center, there are different types of tints. We briefly hinted at contrast. So when you lose some vision, often we lose this contrast sensitivity or the ability to see shadows or different shades of gray. And when we lose this, it's much harder to see, steps. Typically we see steps because there's a shadow or a curb or on the sidewalk when it's partially shady. So there are different types of specialty tints that can really help improve your contrast that are better than sunglasses because sunglasses can reduce the glare, which is great, but sometimes they can reduce what you can see or reduce your vision as well. So there are great tints options out there too. On the right, there's a lot of different electronic devices. On the top, there are two different types of digital magnifiers that again can adjust the contrast, which is very important. On the bottom, there are two different types of audio aids. What's really popular right now and is amazing technology is the Ray-Ban Meta glasses. So this is using AI technology. Has a camera on the front of the glasses and you can use it almost like Siri. You can say, hey Meta, can you read this menu to me in front of me? Hey Meta, what am I looking at in the grocery store? And you can also pair it with all sorts of different applications on your phone that can kind of describe even the scene around you. So there are some really great technology out there as well.
In fact, we even had one of the volunteers at the Lions or the Center for the Blind that she dropped a pill and she had Meta, where's my pill? And it was able to tell her right where on the floor her pill was. So that is really opening up a lot of new avenues to help people. And the biggest thing that I always like to say with low vision, the idea with all these aids is you take the vision you have and maximize it. You do whatever we can. And Dr. McKenna is the expert on this, literally, is you literally find what is the best aid or device or anything to help you live your life better.
Yeah, exactly. And not only vision aids, but there's small changes that you might not think of that you can do around the house. So we talked about how important lighting was. On the upper right there, it's an example of what a high contrast cutting board looks like. So if you're cutting up a light, colored fruit or vegetable, a potato, try to use a black cutting board just to protect your fingers the best we can. There's bump dots, what they're called. So that's little tactile bump stickers that you can put on, your microwave start button or your favorite setting on your laundry machine. So you're able to just use kind of that tactile or use your finger to figure out exactly where that knob needs to be turned. There's also large print calendars and clocks and watches and all sorts of, aids out there that are excellent. What is also wonderful in that the Center for the Blind provides are different rehabilitative services. So that can be everything from orientation and mobility training, so learning how to be more independent and getting around and learning how to use a white cane if necessary. It can be activities of daily living. So this could be kitchen skills, laundry, It can be getting advice on technology. So there are awesome computer programs out there that can either, audio aids, it can read a page to you, it can zoom the text. So there's great assistance there, as well as classes in Braille. And then really important, there's opportunities for both individual and kind of group counseling as well. So there can be a really nice community out there, and it's fun because you can learn what other people have done for them. So everyone has all these awesome ideas that they've said, hey, this, works for me at home, try this. So there's a really nice community aspect too. All right, I think we're wrapping up. So I know we talked about a lot today. We kind of talked about the importance of our annual eye exams. We talked about some normal changes in our vision versus when is something that might be an eye disease or when to come in and have something checked by your eye care provider. We talked about different things we can do to prevent and protect our eye health. We also learned about low vision and different resources that are out there for anyone that's in the visually impaired or blind community. And now we thank you for listening and we are open to any questions. But Dr. White, anything else to add before we go
No,
to
you
questions?
were amazing. This was absolutely perfect. Thank you. The biggest thing that we wanted to do is allow you guys just to get some ideas of, kind of make your eyes are thinking about your eyes, your body, and everything. So we're here. If you have any questions now or even later, feel free to email us and kind of go from there.
Thank you, Dr. Eric and Dr. McKenna. That was fantastic. And thank you, everybody, for joining. I know we have a few retirement committees on here, facilities. Also, our bus one of our buses with 8 passengers has also been listening. But also, when you were talking about low vision and some of the rehabilitation, obviously that's what we're here for, providing rehabilitative services. But also, if you're not there yet but just need a little bit of assistance, we do have a store and it's open to the public. We have one at our San Diego site as well as up in Vista, and we sell all of those things that Dr. McKenna highlighted, including meta glasses, which has really been life-changing for some of our students that have absolutely no vision and can say, hey Meta, find the door, in our pantry, hey Meta, find corn on the cob. So there is a lot out there. I encourage you to come to our store so you can touch and feel and find what's appropriate for you. Andrew's a fantastic manager down in San Diego. Marcella is also incredibly knowledgeable and also has vision impairment herself at our Vista campus. So thank you all. Are there any questions? If you'd like, put it in the chat.
Perfect. Well, we really enjoyed this. And remember, we're going to do this again in 3 months.
Yep. Yes, we will. So we'll probably continue to do them on Mondays at this time. And those of you that registered, we will go ahead and send out an email reminder as well. And we will also be sending out a survey following this call as well.
And spread the news. Tell friends and everybody. The more, the merrier to join us.
Yes, and you don't often get one-on-one time like this with eye doctors, so we appreciate that.
All right, everybody have a great rest of the week and a wonderful summer, and we'll see you in the fall.
Perfect. Thanks,
Yeah,
all.
thanks everybody.
Thank you. Take care.
Bye-bye.
Bye-bye.